if you are one of the millions of Americans who need eyeglasses or contacts to see well, then you probably wake up some days wishing you could actually see clearly out your bedroom window, or that you could see the beauty around you while you swim. Well, each year, wanting better vision prompts millions of Americans to look into laser vision correction. So today, we are chatting with one of the nation's top Lasik specialist, Dr. Cory Lessner from the Millennium Laser Eye Centers. Good morning.
Good morning. Thank you for having me, Olga.
I gotta tell you, I will say that I just went to my eye doctor, 2020. Over 40. Very proud.
Good for you.
But I do want my viewers to know a lot about you, and you have some impressive resume. So listen to this. This is pretty amazing. You have done more than 25,000 procedures. You have more than 20 years experience in laser vision correction, which is amazing. You're often called the Lasik surgeon of the stars.
Who said that?
Who said that? Oh, it's okay. Use the stripes if you can, because you have some pretty big names in Hollywood. Look at this. Actors like Dwayne "The Rock" Johnson and Gabrielle Union. Even some sports celebs like Dwayne Wade, love Dwayne Wade, and Jimmy Johnson, love Jimmy. And you know something else about you? You are the only laser eye surgeon in the country to become the official laser vision correction surgeon to all 4 professional sports teams in your hometown: the Dolphins, the Heat, the Marlins, and the Florida Panthers, which, by the way, is my hometown. Wow!
Yeah, that's
Pretty
great.
impressive.
Yeah, we get to work. We're truly blessed to be able to work with some great people. But I'd point out that that probably represents less than 1% of the people that we treat. The majority of the people we treat are everyday people: firefighters, police officers, teachers, homemakers that make our country go.
But I did want the viewers to know this, because you do have a passion for it, doctor, and it's really admirable, and I applaud you for that. And I read that this procedure can be done in as little as 15 minutes or less?
It actually takes 1 minute per eye on two different procedures that are about 1 minute apiece.
That's it?
With a little bit of time in between. So you're in 2 rooms for 5 minutes from start to finish, from the moment you walk in to the moment you walk out. There's a little bit of pressure in the first room on the eye, and in the second room, you feel nothing. It's just a very cool light show, and most people say, "Is that it?
Is that it?
Wow, I can see, and why didn't I do this sooner? What in the world was I worried about?"
All right, doctor, let's talk about this new technology. How does it work in layman terms?
Okay. LASIK is actually a 2-step procedure. In the first step, much like lifting the cover of a book and the first 50 pages back on a hinge, we use a laser called a femtosecond laser, which delivers north of 1 million pulses in 15 to 20 seconds and creates a flap that's about 1/10 of a millimeter thick. Wow. We then go into another room and we lay that flap back gently, and patients just experience a very cool light show to do a sculpt with a laser that has a tracker that samples eye movements 120 times per second. So it doesn't matter if the eye's moving a little bit, it'll follow it to sculpt a very precise pattern. And we can treat prescriptions up as high as -12 all the way to the far-sighted ranges of +6. And we can treat almost any prescription these days, whereas in the old days we were limited by the amount of tissue that was there.
It sounds very easy, non-invasive, love it so far. Now let me ask you something else. There's no doubt that after 40 the vision starts changing, and that's exactly why I went to the doctor, because I noticed, a little bit of that.
Your arm was not long
But he
enough.
said I still have a couple more years before I need this treatment. But when that vision starts changing, is this recommended? Because it's happening to me.
Right. Well, there's two places where that comes into play. Usually we don't treat people who are under the age of 18 because we want them to be able to sign their own consent.
Got it.
Some people are stable by 18, but most people, especially grad students, people going to law school and medical school, the vision will stop changing by about 28 years of age. However, most people don't realize that contact lenses carry a risk that's probably more significant than having laser vision correction. So when people are not treating their eyes properly and blood vessels are going into the cornea that shouldn't be there, they're getting bumps on the inside of their eyelid, they're getting infections called ulcers or infiltrates.
Correct.
That could permanently impair vision. At this moment there are probably people losing their vision in hospitals around the country from improper contact lens wear. We would do a procedure even if a person wasn't completely stable, but kind of stable.
Okay. Now, I've heard in some cases, maybe not many, but in some cases, even after the LASIK surgery, they may need glasses and contacts. True? False?
We usually don't put people back into glasses and contacts.
Okay.
That's not the reason people are coming to us. My specialty is, or my subspecialty within refractive is refractive enhancements and refinements of people that had surgery maybe many years ago, had radiokeratotomy in the past, or had procedures, and now they're getting to a point where they start to need reading glasses, because the other part of your question was what's happening to you as your arm's getting longer. That doesn't really have anything to do with where we do the treatment. We have two lenses in our eye, the cornea, which is the clear dome that covers the colored part of the eye, and the natural lens inside the eye, which starts to take on impurities as we develop cataracts into our 50s and 60s and 70s. The cornea, where I do the work, takes care of about 2/3 of the sculpting for the eye, of the prescription for the eye, and the lens inside the eye is about 1/3. And so what starts to happen as we get into our mid-40s and 50s is the lens can't change shape anymore because it's crystallizing. And before the impurities come in, your arm is not long enough anymore.
All right, well, I'm going to check it out. I was told by my doctor that I had a couple more years before I'm going to...
If you're having trouble doing that, then, you know, it may be time.
Well, thank you so much. I'm going to check out that online information,
really
Doctor.
Appreciate it.
Thank you. And if you want more information on Dr. Lessner or to check out his free online consultation, just go to havelasik.com. That's havelasik.com. Check it out. Great info there.